Hello and welcome to PA212 Pharmacy Technician Certification Exam Review, and we are in this book. I am Krista. I'm your instructor. This is week 1 and we're going to dive right in. We're in chapter 1 and 2 of your book, so let's go ahead and turn to that. And these are pretty short chapters, so I expect that you get through them pretty quickly. And then your assignment is to answer the odd questions of the review. If I was you, I would answer all of them. This is a great review for the certification exam, and just for your practice, I would answer all of them, but just turn in the odds for me. Chapter 1 talks about receiving medical orders. We start off with retail medical orders and that written prescription order. Go ahead and make sure that you are looking at that prescription that they've given you and all that information that is needed. Make sure that you commit that to memory. Name of the drug prescribed, patient's name, has to have the drug strength, has to have the dosage form, need the quantity dispensed, prescriber's name and address, the DEA number, the date they write it. Remember, it can only be a year old unless it's a C2 medication, then it only can be 6 months old. How many refills? How to take it, who's the prescriber, those things need to be on there. And then it goes on that page, on the next page, page 8, about finding DEA numbers. Make sure that you do that. There are probably 2 or 3 questions on the certification exam about figuring out a DEA number, so make sure that you can do that. And that is, the first letter is either an A, B, F, or M, designates the status of the prescriber, and the second letter is the DEA number is the first letter of the prescriber's name. So those are really easy to check for, and then obviously you have to do that calculation, which they show an example on page 10, so make sure that you review that. Authentication, and clarification of the prescription order. This talks about unreadable, questionable prescriptions that a technician may take. Often the handwriting may be illegible, the signature or other information is questionable. In this case, I would ask the pharmacist. If not, then call the prescriber by telephone and just to verify. It happens that they are probably more thankful that you did call them and ask instead of just go ahead and fill it. Accepting refill requests, and then it goes on to talking about controlled substances and how C2s don't have refills and you can't take it over the phone, that kind of stuff. How to receive prescriptions and in what form you can do that. So that goes into talking about that, and then going into the physician order sheet in the hospital. So the difference of a retail and a hospital. You can just put them all in one order, whereas a retail pharmacy, prescriptions are maybe 1 or 2 at a time, but you have to write different prescriptions each time. Talks a little bit about the medication cart, the unit dose, so make sure that you review that. Then in chapter 2, processing the medication order, we're talking about the different forms. Right away, we're talking about tablets, capsules, enteric-coated, sublingual tablets. Make sure that you do remember what different types there are. And then the table on page 22, make sure that you commit those to memory as well. BID, TID, QID, these should just roll off your tongue because these are prescriptions that you'll be reading all the time. And they will also be on the certification exam, just examples of prescriptions with these abbreviations on them, so you'll want to make sure that you know them. Let's see, going into liquid dosage forms, semi-solids like creams and ointments and suppositories, and then how they are, route of administration, where are they put, is it a drop, is it a spray, is it an inhalant, medicating the eye and ear. One thing you need to know that eye drops can go in the ear, but ear drops can never go in the eye. That is something that if you see it written as a prescription, you can send back because that's not correct. Going into the intramuscular injections, remember those abbreviations can tell you something. Intra, into the muscle, intramuscular, into the muscle. Subcutaneous is right under the skin, and you will need to know what kind of needle helps to do both of those. Give some examples again of the amount of drugs prescribed, that kind of stuff. So make sure that you look over that in chapter 2. And then I wanted to talk about the Pyxis system, Pyxis. I got the chance to work with a Pyxis system in a retail pharmacy where it was an automatic filler. So our top 100 drugs were loaded into that. So, for example, Vicodin, and so whenever that was filled, the Pyxis machine would fill it for us. It would be a 30-day, 60-day, 90-day, and then it would label it for us, and we would just have to tighten the top. It was pretty awesome. And I would say working in a really fast-paced pharmacy like a Walgreens, they have such things as Pyxis that will fill your top 100. So then you're just really filling the ones in between to really keep up and help people not from waiting. Okay, so that's kind of I wanted to talk about in my lecture today. Again, answering the review questions. There are literally 10 of them. You're only supposed to do the odd, so 5. See if you can maybe do all of them, and see if you can not use your book with doing them, because that will help to, again, review for the pharmacy technician certification exam. The quiz, again, also is only 10 questions. Pretty easy, and if you've read the chapters, you will get that. Again, if you cannot use your book, that would be an excellent way to practice as well. If you have any questions about it, let me know. Oh, the discussion I wanted to talk about a little bit was find out about what certification test looks like in your state. So if I'm in Missouri, and it looks a little different for us as well. So if you need help with that, let me know. I'm not going to talk about it because I want you guys to be able to answer it in the discussion, but I will ring in there and be able to communicate back and forth with you there. Have a great week, and if you have any questions, please email me. Bye-bye.